Thank you. So hi, everyone. I'm Philip Alberti. I'm the founding director of the AAMC Center for Health Justice. I'm a social epidemiologist, and I would say a population health rabble-rouser who's worked over almost 25 years to really focus on building the evidence base for achieving health equity. So here we go, 4 slides, 4 minutes. I am a huge fan of this 2006 framework that was created by health equity scientists out of the VA. It describes kind of different generations of health or healthcare equity science in these 3 kind of buckets. So the first generation is really descriptive epidemiology. Which populations are we concerned with? How big are these gaps? Where do they exist geographically, et cetera? Second generation is analytic evidence. Why do they exist? What maintains these inequities? What gives rise to them, et cetera? And third generation, and frankly, kind of the only generation that I'm super deeply passionate about, is that third generation science of solution, right? Evaluation science, implementation science, community partnered science. We can talk in the breakout about the continued value of generations 1 or 2. But for me, I'm really focused on identifying community driven solutions that close or narrow inequities in health. So where might we look for some of those solutions? So this pyramid is from a forthcoming paper, what we call a population health impact pyramid for healthcare, but it's really applicable and relevant across sectors. It's based on Dr. Tom Friedman's influential 2010 public health impact pyramid. And while we can and must look for solutions, those health equity solutions, across all levels, from education to advocacy, note what is most impactful at the population health level, those bottom structural tiers, right? And we know that health inequities are only population health dynamics, right? They don't exist for individuals, only for the populations, and interventions at those basal levels really get to that kind of change. And so while I support and have worked to spark action and build evidence across all of these levels, personally, professionally, I'm much more interested in the kinds of coalitions that bring together sectors representing the vital conditions that all of our communities need to thrive, right? Coalitions that are committed to organizing and advocating for changes to laws and policies and regulations that shift entire communities toward health equity and opportunity with the stroke of a regulatory or policy pen, right? Policies that explicitly counter fundamental root causes of poor population health, racism, classism, sexism, homophobia, right? The absence of which must be considered fundamental causes of wellness and health. But no matter where your passions, your personal passions lie across these tiers, no matter at which level the kind of intervention and evidence you're building fits in, there's one common denominator, and that's an unerring commitment to community engagement. And so let me say what I don't mean by community engagement is kind of engaging your community advisory board once or twice a year with all of your great ideas. Hey, what do you think of my great ideas? And they give you a thumbs up and you feel good, you check the box, you've community engaged. That's not what I mean. What I do mean is really captured in those core principles in that green circle: co-equal, co-creative, inclusive, multi-directional, right? Founded in trust. And what happens when our research partnerships or evaluation partnerships are defined by those characteristics? Well, of course, stronger relationships, more knowledge for everyone in all directions. That leads not only to better health and healthcare policies and evidence, but to thriving communities, improved population health, and a narrowing or an elimination of inequity, right? And all of that, our commitment to solutions at the base of that impact pyramid, the primacy of community wisdom, the imperative to co-develop the kind of scientific evidence that can be embedded into laws and policies at all levels, organizational, local, state, and federal. That's how the AAMC Center operationalizes health justice. We talk about keeping one foot, our process foot, in community wisdom and multi-sector partnerships, the other foot, the action foot, in that research to policy action imperative, and then using both feet to walk towards health equity in a very explicitly anti-racist and anti-discriminatory way. So I'm excited to talk about any and all of these issues during the breakout.
Thank you. That was fantastic to hear some of the justice lens on all of that work and thinking about population